Everyone gets a scar after lip lift surgery, but some people obviously heal better than others. So during the procedure, I use a 15C blade. I think it's always better to use what we call cold steel to make incisions on the face rather than these hot cautery methods of incising the skin. So I usually start and stop the incision where the ala goes from a horizontal to a vertical type of configuration. And this is probably the most critical part in terms of minimizing the potential for poor scarring. And that's taking a deep plane approach to lip lift surgery. As we get down to those muscle striations, we then create a skin muscle flap. So there's a separation between the skin itself, the deep, thick element of the skin, separated from the actual muscle that lives beneath it, and creating that separation and chasing that down closer to the vermilion border, and then taking that skin and redraping it towards the base of the nose for closure, which usually leads to better healing. Another part of this to again improve the actual appearance of the scar is to place the deep sutures in a deep position. Once those deep sutures are placed, the edges of the skin need to align very closely. What some people do is that they leave those skin edges misaligned after the deep stitch is placed, and then they try to adjust for that with the surface stitch. But that usually doesn't heal in as ideal of a way compared to making sure that that height is matched up as perfectly as it can be. And then you still have to come in with meticulous closure of the skin itself. And as I'm working, if I find that the skin is very thick, I might inject some Kenalog, which is a steroid, into the area as soon as the surface stitches are in. Post-operatively, in order to minimize scarring, it's very important to try to limit the movement of the upper lip for at least 2 weeks. So that goes for the foods that you eat. They should be soft foods, not using straws, being very careful with limiting animation of the lips. It's quite restrictive for at least the first few weeks, but it's very important as you heal up. Scar gel is a big part of all this, and we give patients our very own scar gel that you may have heard me talk about in other videos, our Feel Confident Scar Gel. Sometimes post-operatively, if the scar starts to rise up, we might use Kenalog to help flatten that scar. And some people end up getting laser resurfacing of the scar to help buffer it and to help it look closer to the skin that surrounds the scar. Most of our patients do not get laser treatments, but for the ones who do want that, I usually recommend they wait about 9 to 12 months minimum before going in for laser resurfacing. Even in the best of hands, suboptimal scars on the face are always possible, and that goes for lip lift surgery or any other surgery on the face. So it's something to be aware of as you consider this surgery.